Physicians, the culture of complainers. The black hat thinking attitude is not working in their favor. After all, in general, and by nature, physicians are black hat thinkers because they tend to stare at a decision's potentially negative consequences before they embrace the opinion. Physicians are always cautious and defensive with every judgment they come up with, merely trying to see why it might not work. They highlight the vulnerable points in a blueprint, providing the opportunity to eliminate them, alter them, or prepare contingency plans to react to them. The physician black hat attitude only goes so far, as policies and bureaucracy ultimately prevail over physician decision-making style. The latter is the prerequisite to what we call chronic naggers or complainers amongst physicians. Physicians are complainers. They are profoundly distressed by healthcare problems that they feel powerless to improve. They feel simultaneously irritated and unhappy about their work condition and worry that it is their fault if a patient does not receive the care they need. Furthermore, they do not know how to reassure themselves. Physicians sense the healthcare problem before delivering to patients. They and other healthcare experts alike are at the front line of medical care to their patients. It is just like knowing the negative outcome and how it will affect the quality of medical service they render before that policy is put to work. Such a position is the upshot of black hat thinking. Nonetheless, policies and procedures funneled by non-medicals and politicians place the physicians in an awkward position, that is, take it or leave it. But physicians have obligations to their patients. That obligation will typically take the extra step to circumvent the negative consequences of some of the wrong policies brought up by faulty decisions. Generally speaking, physicians by trade have been passive in administrative decisions because politicians and administrators are challenging, if ever, black hat thinkers. Their attitude is to focus on the possible alternative options that maintain public support. The latter places them at a much higher advantage over the physicians. The majority of physicians are complainers. The combination of black hat thinking attitude, commitment to their patients, and passivity in response to administrative decisions has created a new behavior in the physician community that is complaining. But complaining goes so far and gives the impression to focus its positive outcome on the individual physician versus healthcare. At the very least, that is what Dr. Abe Kashani speculated on his blog in 2014. According to him, one can see 4 reasons why doctors who protest are those who become successful. First, because complaining implies that physicians are actively acknowledging that there is a problem with the prevailing circumstances. Second, by opposing, they tend to express that they have enough self-esteem to merit better options. Third, those who complain are trying to show that they are not hesitant to express their dissatisfaction. And finally, physicians see complaining as an indicator of urgency for reform. Kashani assumes passive doctors are inadvertently drifting along with the stream. The complainers always find the flow impediments to getting ahead of the rest of the medical community. What Dr. Kashani implies summarizes the nuts and bolts of how physicians are and what delineates the individual physician's success. His vision also points to the same, black hat thinking trait that physicians typically possess. Furthermore, passivity and any given physician's activeness are the upshot of the balance of power in which physicians should proceed. The passive may be the burned-out physician who kept trying to deliver top-notch care to their patients but couldn't sustain it any longer. In contrast, the active complainer may be the one who finds the opportunity to use the system to their benefit, irrespective of the effect that decision would be having on the patient care. The patient-centered physician will burn out while complaining. Physician burnout remains to be very high, according to a 2020 report. The majority of physicians feel overly pessimistic about any future improvement. Of all the physicians surveyed, 42% felt burned out. According to a survey published by Medscape, independent physicians might experience less burnout because they are in charge of their workload. 55% of physicians alleged they had to cope with excessive bureaucratic responsibilities, while 33% held they spent many hours at work. Over the last decade, long periods, workload, and a shortage of support have unswervingly outranked as the top contributors to physician burnout. More than 60% of physicians said they do not plan to seek help for their burnout or depression. About half said their symptoms weren't severe enough when asked why, while others responded that they could deal with their burnout without professional help or were only too busy. Once again, physician burnout is a symptom and not the disease, per se. It is the product of a responsible and good doctor rewarded for their black hat thought process with an unclear destination. Despite all said, all they can do, at best, complain. But is complaining about going to help? Physicians have become a profession of whiners. Doctors are becoming more than ever recognized as whiners. Those who have met physicians in meetings, dinners, parties, social media, and doctor lounges have probably noticed how much time they spend daily complaining about extended work hours and work overloads. They continuously criticize the system and even try to discourage the junior from pursuing the medical profession. The mainstream physician community is riddled with the bulk of upset voices indicating that modern healthcare is a monster, even though they want to help and practice what they know best. Physicians whine strongly acknowledge that despite the need to refurbish and repair significant parts of healthcare, many change elements imperil the ability to interact with patients and disrupt the physician-patient relationship. Physicians don't justify themselves. They do not rant for treasure or personal distinction but for those who trust their parties to the medical service.